Hello, Esteban. My name is Anthony. I'm a student physical therapist assistant affiliated with Owens Community College, and I'm just going to be working with you today. So looking at your chart, I can see that you have a past medical history of Parkinson's disease. You had a fall out of a window. You've had some cervical trauma from martial arts as well. And since then, you've been having some chronic cervical pain around the neck area and the shoulders. And currently, I can see that you're here today because of your Parkinson's and how it's been progressing and getting worse recently. And you've been having some decreased balance, and you've been freezing more often when you're walking. So we're going to just be looking at those impairments. I'm going to be educating you on those and their potential causes and what we can do, some exercises to try and help with them. Okay, so let's go ahead and get started. All right, Esteban. Now I'm just going to be teaching you a little bit about some of your impairments that you've been having recently. So one of them I saw was you've been having difficulty with transfers. So transfers like moving from the edge of the bed to a chair or some kind of movement like that. And that can be caused by having some weakness in your legs, because I saw in your chart that you have 3 out of 5 on your strength tests when we're looking for more 4 and 5 out of 5s. So it could be caused by some weakness. So it's important for you to be working with us today so we can try and increase that strength in your legs so you're able to transfer more safe and securely without having any, by decreasing your fall risk. Do you have any questions or concerns about your impairments with transfers? All right. For your second impairment, I can see that you've been having some difficulty with balance recently. That could be caused because of your decrease in coordination that you've been having. So it's important for you to work with us today to try and increase that coordination and that balance. That way that when you're walking around and you're moving and you're doing things like transferring, you won't have such a high fall risk. You'll be able to do it a little bit safer. I know you've said that you're afraid of falling, especially in new places. So this can try and help with that. So you have any questions? And the last impairment we're going to be looking at is your trunk rigidity. What that is it's your tightness that you have that's causing you to move all in one. Your whole torso moves all as one piece instead of as each individual body part moving. So it can be caused by tightness, especially in the chest and abdomen and the back. It can be caused by that tightness, making it so you can't move the body parts by themselves, so they all move together. So it's important for you to be working with us today so we can try and increase that range of motion, that amount that you can move, so you're able to try and get some of that movement back so you aren't just all moving together like this. Do you have any questions or concerns? All right, Esteban. Now we're going to go ahead and do your first intervention here. This is going to be to try and help with your difficulty that you've been having with transfers recently. So we're just going to do the setup of when you're going to do your transfers, so you can get it ingrained in your head and get used to doing it every time you go to stand up. We'll work on the actual standing part and the sitting down part later in another session, but for now we're just going to go ahead and we're just going to focus on one part of your transfers. So when you're practicing, when you're doing this, I'm going to have you move towards the edge of your seat or the edge of the bed. That way you can get up easier. I'm going to have your feet flat on the floor, your knees shoulder width apart, and I'm going to have you have your shoulders and your hips are going to be parallel. So you're going to start out sitting straight up with your spine straight. So now that you're in starting position, you lean over and you bring your nose over your toes. So you're going to lean over. And when you do that, you're going to put your hands on the edge of the bed so you can push off when you are going to be doing your transfers. So I'll go ahead and show you it again. You bring your nose over your toes, and then you put your hands on the edge of the bed. So like this. This makes it safer. It makes it so you have an easier time getting up, and it makes it so you aren't just rocking to get up, because when you are rocking to get up, you're using momentum, not your strength, and you can lose your balance when you stand up. If your wife is trying to help you stand up, you could accidentally bump into her and knock her down. So this just makes it more slow and controlled, so it's safer for you. So I'm going to have you do this 8 times for 3 sets to try and get it ingrained into your head. So if you start to feel dizzy from looking over and rocking a little bit, then you can go ahead and take a break and wait until that dizziness subsides before you go ahead and do it some more. But we're just going to be aiming for you to try and get this down, and then we'll go ahead and do the other parts afterwards. All right, now we're going to start on your second intervention. This is going to be to try and help with your balance issues that you've been having recently. So I'll go ahead and show you it first. So you're going to be standing, and your feet are going to be shoulder width apart, so that way you're not off balance to begin with. And you're going to have your hips and your shoulders parallel to the floor, and then you're going to try and have your spine straight, so you're not leaning to the sides or forward or anything. So you're in a good starting position. So when you go ahead and do this, you're going to be bringing your leg forward with your knee. You're going to drive your knee using your hip muscles here. So you're going to drive your knee forward, take a big step, and you're going to throw your arms back. And you're going to say 1. You're going to say it loud and proud. Then you go back into starting position. Then you go ahead and take a step, drive your knee. 2, 3, like that. This is going to be a little difficult at first because you're having balance issues, and you're going to be on one foot and you're going to be shifting your weight. But this is something you do when you're walking. This is something you're going to be doing to like step over something. It's going to be good for you to feel that weight shift and get your balance back up. So it's going to be a little difficult, but as you get better with it, your balance will improve too, and so will your coordination. So if you start to feel tired from taking your steps, you start to get out of breath and you need a break, then you can go ahead and take one. We don't want you to fall. We just want you to be safe and secure when you do this. So taking your step not too far, not too little. You want it to be a good step. Throw your arms back and say 1, 2. So we're going to have you do this on one leg first, and then we'll have you go to the other leg and drive that leg forward and take a step. So we'll have you do it about 6 times on one leg and then 6 times on the other. So, and then we'll have you do it 6 on the other leg again and 6 on this one. So 4 sets of 6, and you're going to switch your legs. All right? And now we're going to be working on your final intervention for today. This one is going to be trying to help with that trunk rigidity that you have that is caused from your tight muscles in your abs and your back and even your chest. That's making it so when you go to turn, you turn your whole body instead of being able to rotate. So this exercise, you're going to have to rotate a little bit. It's going to be a little hard, but as you get to doing it, it's going to become easier and you're going to get better at that rotating. So first, I'm going to have you in starting position with your feet flat, shoulder width apart. I want your shoulders and your hips to be parallel with the floor, and I want your spine to be straight. That way you're in a good position, you're not off balance to begin with. And then I'm going to have you reach over to the side as far as you can safely, and then I'm going to have you twist. You're going to bring your leg up, you're going to twist your torso, and you're going to hold your arm and you're going to act like you're throwing a ball. 1, 2, 3. I want you to say it. I want you to say reach. 1, 2, 3. And then after you do it about 6 times on one side, I'm going to have you do it 6 times on the other side. So then you're going to be reaching this way and then twisting. 1, 2, 3, like that. So we're going to try and aim for doing 4 sets, so 2 on each leg. You should go from one leg to the other leg and then back again. If you feel like you're getting tired in your legs and in your trunk from standing and balancing and twisting for so long, then you can take a break and then you can resume activity once you get your breath back and once you're ready to exercise some more. All right, Esteban. So I have your HEP right here, your home exercise program. I also emailed it to you so you'll be able to see it a little bit easier. But going over it, it's your reach and throw exercise that we went over earlier. That's to try and help with your trunk rigidity. So for this, like I was saying earlier, you're going to be standing up. You're going to have your feet shoulder width apart, and you're just going to be reaching almost as if you're getting a ball, and then you're going to be twisting, and then 1, 2, 3. And it says that that's 1 rep. So we want you to do 6 reps for 4 sets. And then you can take a 1-minute break in between. And if you start to feel tired or fatigued because you're having some endurance problems, you can always take a break and come back to it in a little bit. That way you decrease your fall risk. We don't want you to fall when you're doing this at home. And if a fall does occur, then you can go ahead and call 911 and get medical assistance, okay? So I am going to be sending this home with you, and I also emailed it to you. So if you have any questions, then let me know. All right, that's all for today, Esteban. Thank you for your time and coming here. Thank you for doing some exercises with us. Make sure you do your HEP when you're gone, and we hope to see you next time. If you have any questions or concerns with any of the stuff we went over, then you can call me or the PT or even your physician. All right, see you.